Hi, I'm Dr. Cindy Cloud, and I'm here to discuss some pointers and tips for success with your new puppy. The first couple of things I'd like to discuss are our vaccine series. We like to give those at 6, 9, 12, 15, and 18 weeks of age. Puppies are born with maternal antibodies that will fight off a portion of our vaccine every time that we give it. By 16 weeks of age, the maternal antibodies should be gone, and we should mount our best response after 16 weeks of age. So therefore, we usually space those out accordingly. When we give the last vaccine after 16 weeks of age, they're going to mount their peak immunity. And since we live in an area that is very heavy in parvovirus, it's very important to wait until that last vaccine to give it at 18 weeks of age. The second thing I'd like to talk about is not taking this puppy anywhere until we're fully vaccinated. The parvovirus can live in the environment for up to 9 years, which means that if your puppy goes into those areas, high community areas, such as puppy parks, grooming, bathing, boarding, those types of places, and day camps, they can be exposed to parvo. Even if they've had a couple of vaccines, they can still develop a parvo infection. And our vaccines are designed to help their immunity at a young age. The second thing I'd like to talk about is vaccine reactions. If your puppy received a vaccine today, there is a small chance that they might be sore at the location where we've given the vaccine over the shoulder. But also, if they have a reaction to it, they will have swelling of the face, puffiness of the eyes. Sometimes they'll become profoundly itchy when we give those. So if you notice any unusual effects after we've given a vaccine, please head back up here or call the Small Animal Emergency Clinic on 66 in Milwaukee because they'll need to have some type of injection to counter those effects of the reaction. The next thing I'd like to talk to you about is deworming your puppy. We deworm these puppies because oftentimes worms are transmitted from the mother to the puppies through the placenta and through the milk. And those worms are often transmittable to humans. So hookworms and roundworms are our most common worms that we see in puppies. When we give a dewormer, don't be alarmed if you see any worms come out in the stool in the next 24 hours. That indicates that it was effective in working. We're also going to ask you to bring in a fecal sample at one of your initial puppy vaccines. We check for hookworms, whipworms, roundworms, coccidia, and giardia, which some of those, as we've discussed, are transmittable to humans. So we just want to make sure that they are off to a good, healthy start. The next thing we're going to talk about is our heartworm preventatives. We have a couple of different options. There is just a preventative called TriHeart, and it is dose dependent. And so heartworms are actually spread by the mosquito. So say there's a dog living within your neighborhood that has adult heartworms living in its heart. Those adult worms make tiny little baby worms called microfilaria. When a mosquito bites that dog, it picks up the baby worms, and when it comes and bites your dog, it injects those worms into your puppy. When you give your heartworm preventative once a month, you are killing the baby worms and preventing them from becoming adults in your dog's heart. We are going to dose it out by weight, and so initially we'll send you a single dose until we've reached our full vaccine series. So each month that you come in for your vaccine, we're also going to weigh your puppy and make sure, because these are dose dependent. Once your puppy hits a certain weight target, say if it's a larger breed dog and it gets over 50 pounds, we're going to send you a 6 or 12 months worth of heartworm preventative. When you purchase your heartworm prevention through your veterinarian, it comes with a guarantee that says that if your dog ever comes up positive for heartworms, we go to the company and we ask them to pay for the adulticide treatment to treat those dogs. There are many different options and we'll help you select the best heartworm preventative. The other option we have is called Simparica Trio. Simparica Trio does heartworms, but it does intestinal parasites as well, so hookworms and roundworms. But the nice thing about Simparica Trio is that it prevents and kills fleas and ticks. Fleas and ticks can spread disease to your dog and to you as well. So things like Lyme disease, ehrlichiosis, anaplasmosis are very common in our dogs. We live in an endemic tick disease area. We see a lot of dogs that have platelet disorders, neurologic function disorders as well as a result of tick disease. So also dose dependent based on weight. So we'll do a single of that each time they come in. We do have another option called Bravecto, but we want to wait until they're a little bit older to receive those. And as your dog grows, we'll discuss other options that are available. But for right now, these are the ones we want to focus on. The next most common question that we have is when to neuter your patient. Your puppy is going to have a recommendation based on age and weight. So smaller dogs will typically do, the soonest we'll do the neuter is around 6 months of age, and we'll wait until the adult canine teeth start to come in. Those are usually the last puppy teeth to come in. And if the puppy teeth don't come out, we can pull those at the same time at the neuter. For our larger dogs, we've kind of gone away from neutering at 6 months of age. We are starting to recommend to have those neuters closer to 15 to 18 months of age. We are finding that there is a direct correlation between early neutering and orthopedic issues in some large breed dogs. And so for that reason, we are holding off on neutering until they get older and their musculoskeletal system is more developed. The second to last thing is puppy food. Your puppy is growing and so needs baby food. And so one of the things we recommend is to feed a puppy food until they're 12 to 18 months of age. 12 months for the smaller breed dogs and then 18 months for the larger breed dogs because they're continuously growing until they're 18 months of age. And then last but not least is potty training, because that's the most important thing that everybody wants to make sure that they're successful at. Because this can change your lifestyle and your relationship with your dog. So the first thing that I always tell my owners is that the age in months is how long the bladder can hold it in hours. So for example, 2 months, 2 hours, 3 months, 3 hours. So set a timer on your phone or your microwave at your house. A lot of times 2 hours or 3 hours can go by pretty quickly and now you've got a mess on the floor. If you cannot have eyes on your puppy at all times, then I recommend keeping your puppy in a crate when you can't be supervising them. I call it our nanny or our babysitter when you can't be present to watch them at all times. Puppies can get into trouble and they can have urinary accidents. Also, there are things like potty bells and doorbells that you can use. This is one that would hang from your door. And every time your puppy goes outside, you can teach them to ring the bell, and it teaches them to go out. A lot of times you're telling us that they need to go out, but you're not paying attention, or it's a non-audible clue. For example, they may be circling around and sniffing, and then it just happens so quickly. If they do have an accident in the house, we do recommend an enzymatic cleaner just to make sure that you're cleaning up the smell of the urine or feces, because a dog will continue to go back to those same areas. You might have to get a black light. I like the fluorescent black lights that you can shine, just turn off all the lights and use the black light, and it'll help you localize and kill those areas that the dogs might continuously going back to. And that's it for our tips on how to successfully start your puppy out in your new home. Congratulations. If we haven't covered any topics that you have questions on, please don't hesitate to reach out to us and give us a call. Thank you.